Good morning and welcome to Ask Dr. Murphy, This Week in Public Health. I hope everyone is doing well today. My name is Katie Berg. I'm a research study coordinator with the Havey Institute, and I'll be leading today's discussion. I'd like to welcome and introduce Dr. Robert Murphy, who has a special announcement for us here today.
Today is our first day of that we're going to be posting our newsletter on Substack. And so if you just go to drmurphypublichealth.substack.com, you will get our newsletter right there every day. And we're actually going to go back to the first of the year. So all those reports that we report every week will be up on the Substack. So this is just another enhancement and can give you a little background information and the links to all the articles that we're talking about.
Mhm.
All right.
Sources, all very exciting stuff. So we're excited to get that out to you. It is 100% free. You do not have to pay. And if you put in your email, like Dr. Murphy said, you can also get that source document sent right to your email every week. So we're really excited to be launching this and we look forward to seeing you there. But getting back into it, Dr. Robert Murphy, of course, is the executive director of the Havey Institute for Global Health and the John Philip Fair Professor of Infectious Diseases here at Northwestern's Feinberg School of Medicine. Today, Dr. Murphy will be addressing the latest headlines through today, February 27th, and we welcome any questions or comments at any of our social media or through our new Substack. Starting today, we have a COVID study on preeclampsia and miscarriage risk in pregnant women. Can you break down the findings, Dr. Murphy?
Yeah, so vaccination in pregnant women has always been kind of a touchy subject, an area of concern. Is this going to lead to an adverse outcome in the pregnancy? You know, just, these are all theoretical possibilities. There's been a lot of studies now done in pregnant women with the COVID vaccine. And this is just another study that came out recently in eClinical Medicine, which is part of the Lancet group by European researchers from around Europe, very highly respected. And they looked at 6,527 pregnant women in two cohorts, followed from 2020 to 2022. Among the study participants, 33.2% tested positive for COVID. So 1/3 of the group got COVID. 57% or so were unvaccinated. And based on the study, a full vaccination reduced preeclampsia, which is a terrible condition during pregnancy, that was reduced by 15%. And if you got a booster dose, it went up to 33%. And importantly, women who had underlying conditions that predisposed to preeclampsia, it dropped 58%. So the vaccine really had this remarkable prevention in this serious complication of pregnancy that includes high blood pressure, high concentrations of protein in the urine, and kidney damage or other signs of organ damage. So it's a very serious complication, and the vaccine not only didn't cause it, but it actually prevented it from happening in this group of people. So, we're looking for long-term complications, and what we're doing is we're finding long-term benefits in many cases. So we've got to look at it all together.
Absolutely. That's a really great point. It is important to, of course, look for any long-term effects, but the long-term benefits, like you said, that we could not expect are really impressive to see as well. So great news there.
Mhm.
We do have another study, though, this time looking at long COVID, which we've talked about a lot, but it's hard to classify. Here we have another study that is linking long COVID to depression and anxiety. Can you break down the findings for us?
Yeah, this is a study published in BMC Public Health from Springer Nature Publications from the University of Missouri and the University of Michigan, findings on long COVID. And they looked at 4,732 adults. And they found that adults with long COVID were substantially more likely to experience a mental illness symptom following the COVID and getting long COVID. 3 years following the infection in adults of long COVID, 17% reported depressive symptoms compared to just 7.5% of those without long COVID. So like 2 times higher. Similarly, the long COVID group had 17% of anxiety symptoms, and the group that didn't have that was only 9%. So overall, adults with long COVID had 86% higher risk of depression symptoms and 60% higher risk of anxiety symptoms in the 3 years following getting COVID. So it's a very serious disease, and we're learning more and more about long COVID as time goes on. And it's just another reason why you don't want to get COVID.
Absolutely. Another reason to look forward to that vaccination and to be as safe and healthy as possible. But unfortunately, another respiratory illness, the seasonal flu, has claimed more children's lives and more adults too. Can you break down the numbers?
Yeah, five additional pediatric deaths were confirmed, bringing this season's total to 71 children. So 71 children have died. Now remember, flu vaccine is approved for kids 6 months and older, although those recommendations are being watered down as we speak. Um, we're still in the flu season. We're sliding down into the moderate level of flu from the very high level. And that's very typical for January and February. March, it will continue to go down and then really get to lower levels in April and May. COVID is much more spread out during the year, although there is a peak in the winter months, but they have peaks in summer too. But anyhow, this is really about influenza, and respiratory syncytial viruses are the third one. So anyhow, the estimates so far for the current flu season now caused 24 million illnesses, 310,000 hospitalizations, and 20,000 deaths in the United States. And of course, the older people and very young children are much more at risk. But really, everybody really is at risk for at least getting sick and maybe ending up in the hospital.
And this is a point you have made before, but you know that the flu vaccine isn't as effective as, say, the first round of the COVID vaccines. But when you hear numbers like 24 million illnesses,
Yeah.
even a lower efficacy can make a huge difference.
Yes, very good point, Katie. You're talking millions and tens of millions of cases. And this is probably grossly underreported because most people are not diagnosed.
Mhm. Now, somewhere where we're not seeing millions of cases, thankfully, but now into the 1,000+ cases, measles outbreaks in the US. More everywhere and more in South Carolina. Can you break it down for us?
Yeah, South Carolina is slowing down. Currently, there's been 1,136 confirmed cases overall for measles this year, with an increase of 154 from last week, mostly unvaccinated people, resulting in 58 hospitalizations. We have the 3 deaths that were still reported. No change there. Uh, South Carolina has the most, 979. And importantly, though, only 6 new cases in the last week. So it's tapering off there. But what's happening is the epidemic is it'll float around the country and get pockets of people who are unvaccinated. So it should pop up someplace else, and it is popping up in other places. Um, Recently, 12 members from the CDC Foundation arrived last week to help the South Carolina group kind of get rid of or help with controlling the pandemic in that state. Now, the CDC Foundation is not the CDC. It was set up by the government, but it's an independent group created by Congress to support the CDC through charitable contributions and grants that it gets. And they sent people out there. Why the regular CDC didn't send people out there, who knows? We don't know. But at least they're getting some assistance and getting their epidemic under control.
It's good to see that they are finally sending some people over there, or if they had before, at least they're reporting it now. So that
Mhm.
is some positive news. But our final four stories for, excuse me, our final stories for today revolve around the CDC's Advisory Committee on Immunization Practices, ACIP, and the decisions they've made around childhood vaccinations. Lots of news here. Can you break it down?
So the point is that the ACIP, which is the committee that advises the CDC on its recommendations for vaccine, recently decided that they should reduce the childhood vaccine schedule from 17 to 11 immunizations in the United States, similar to what is done in Denmark. And they actually use Denmark as one of the reasons why they were doing it. Denmark has a population of Wisconsin. It's a very heterogeneous, a very homogeneous society, and everybody has health care. It's a wealthy small country with a few disparities. So anyhow, so this is not a good idea in the United States, which is so huge and so diverse. Anyway, 14 states have gotten together, and the governor of Pennsylvania filed a suit against the federal administration asking the courts to nullify this current ACIP recent decision to reduce the vaccine schedule. So they're in court about it now. That committee has been, the original committee was completely fired, and a new committee put in of basically people who are anti-vaxxers and people that don't believe in the whole concept of vaccines. So this whole effort now is in addition to the professional societies, which also went to court last summer, filing basically the same thing. And the groups that signed on to that lawsuit are the American Academy of Pediatrics, which is located in the Chicago area, the American Council of Physicians, the American Public Health Association, the Infectious Disease Society of America, the Massachusetts Public Health Alliance, and the Society for Maternal Fetal Medicine. So that's a court, that's a process that's ongoing, and this is a new one on top of that. So in other words, trying to undo basically the damage that the currently constructed ACIP is recommending, which would be very bad for the public health in this country.
Very bad indeed. And we're doing our absolute very best to track these changes as they happen in real time. Unfortunately, as we mentioned a few episodes ago, many of these databases and trackers are no longer being updated for monitoring infectious diseases and such. So we will do our best to bring you the most updated and accurate information on this topic. But I would like to thank you, Dr. Murphy, for your time and your expertise, explaining it to us and bringing us this, at least what we have.
Yeah. There are plenty other independent, non-federal authorities, many states in particular, but professional groups, like I already mentioned, that are continuing to look at this problem. And of course, many other countries in the world, they're doing the same thing. So we're going to have to rely on them and basically forget what our federal authorities are recommending at this particular time.
And on that note, thank you, Dr. Murphy, and thank you all for joining us for this week's Ask Dr. Murphy, This Week in Public Health. As a reminder, please sign up and subscribe for our new free Substack. If you have any questions or comments, please leave them down below or at any of our social media. We'll see you next week.
Great.